Well, my name is Rhonda Cooper. Good evening, everyone, and welcome to our Medicare presentation tonight. I am an independent insurance agent located here in Suffolk County, and I'm licensed to sell Medicare plans in New York and in Florida. We are going to be doing an educational meeting tonight. This is not a sales meeting. And if whoever's sharing the screen can share it with everyone, we can get started.
I'll go ahead right now, Rhonda.
Okay. I also want to tell you, I do sell plans for 10 companies and over 20 plans. And if you do get in touch with me, naturally, I'm also a healthcare professional. Everything we discuss is certainly protected and confidential.
And we chose Rhonda to work with our clients because she is an independent agent, which is important.
I work with the Financial Planning Association. That's really also our connection. So you can start the presentation. So this is getting to know Medicare. Medicare Made Clear, and it was developed by United Healthcare. But like I said, this is an educational meeting. So the top questions of that people have for Medicare, because let me tell you, most people getting close to 65 years old, whether they're working or not, have no idea what Medicare is. It is just this thing that exists, and someday I'll be on it, and it's free, and it's going to take care of everything. But we're going to clear that up. We're going to talk about what Medicare is, who can get it, if you can have it and continue to work. What does Medicare cover? What does it cost? How can you choose the coverage that you need, and where can you get more coverage? Where and when can you enroll? And can I change my coverage? And of course, everybody wants to know, how can I save money? Next. Okay, so we'll start with, what is Medicare? Medicare, of course, is a federal health insurance program for eligible United States citizens and legal residents. It is funded in part by the taxes you pay while you're working. You'll notice on your check, on your pay stub, you'll see there's a little Medicare section, and it is individual. It is not a family plan. So if there is a couple and they're both on Medicare, one can get one plan, one can get a different plan. But Medicare is not free. Like I said, it's not family plan. It's not Social Security, but it works with the Social Security Agency, and it is not Medicaid. Next. So now I'll tell you what Medicaid is. That is a state government program that helps pay for health costs for individuals, families, and children with limited income and resources. And programs do vary from state to state, but do follow federal guidelines. So Medicare was a federal program. Medicaid is a state program. But there are plans, there are people that have Medicare and Medicaid. So we actually have plans that are called dual plans that work together. Next. So let's talk about who can get Medicare. Like I said before, United States citizens and legal residents. The legal residents must live in the United States for at least 5 years in a row, including the 5 years just before applying for Medicare. You have to be 65 years or older to get Medicare, or if you're under 65 and have had disability for more than 24 months. You have to have disability for 2 years. And of course, people with end-stage renal disease or ALS can also get Medicare, even if they're not 65. So like I said before, You can have Medicare and Medicaid. It's called dual eligibility, and they can work together for health care. Do I need Medicare if I plan to work past 65? Well, that's a great question because a lot of people are certainly working past 65 now. And how does Medicare work if you're 65 and you're still working? Well, generally, if you're working and you pass 65, you can apply for Medicare Part A only if your company or your employer has 20 or more employees, okay? And the health coverage has to be considered creditable, which means at least as good as Medicare, okay? If your company has less than 20 employees, you are really required to be covered by Medicare completely, not just Medicare A, but Medicare A and B. And here we have a scenario about spouse. So there's two things to look at with this. If you are covering, if you're working and you're covering your spouse and your spouse turns 65, you have to discuss with your employer if they will continue to cover your spouse if they are over 65. And if you are the enrolled recipient of employee benefits and you leave your job at 65, you really have to look carefully at what's going to happen to your spouse, because at that point, your spouse is going to lose coverage and is not going to, perhaps not 65. They would have to go on marketplace insurance. So that's something to consider, perhaps delaying retirement. Next. Okay, so Medicare and your employer insurance can work together. I can give you an example of myself. I continued to work full-time until I was 67, and I just signed up for Medicare Part A, which is hospitalization, and then that becomes my secondary. My employment insurance remained my primary insurance. But if you take any part of Medicare, as like it says, you will no longer be able to contribute to a health savings account. And also Medicare will not cover anyone but you. So consider your dependents when you decide to go on Medicare, if you're covering them. And what does Medicare cover? So Medicare, original Medicare, has two parts, Medicare A and B. A is hospital, inpatient hospital care, and Part B is everything outside the hospital. Next. Okay, so when we're talking about Medicare Part A, here is what's covered. Your hospital room and meals, everything in the hospital with some exceptions. Care in special units like intensive care, prescription drugs, any kind of infusions you're getting while you're in the hospital, all your lab tests, x-rays, medical equipment as an inpatient, operating room and recovery room services, skilled nursing services, some blood transfusions, hospice care, including medication, is covered by Medicare Part A. Now, the next one is tricky, part-time skilled care for the homebound, but this is only after a qualified inpatient stay. So in other words, if you have a stay of over 3 days in the hospital and you have to continue to be on IV antibiotics, let's say, they will send a nurse to the house and Medicare will cover that to help administer the IV. And rehab services after a qualified inpatient stay, same thing. Patient has, a person has, let's say, a hip replacement, and they come home before they can go out to physical therapy outside the home. Physical therapy comes to the house, and that is covered by Medicare. Next. Okay, so facts about Part A, hospital insurance, it is premium free. There is no charge if you or your spouse worked and paid taxes for at least 10 years in the United States. You cannot be denied coverage. The coverage is nationwide. If you travel to Florida, God forbid, and you have to be in the hospital, you're covered in a qualified Medicare hospital that accepts Medicare. Coverage and costs of per benefit period must be admitted as an inpatient, not an observation status, and you have 60 lifetime reserve days in the hospital. So Part A, and now we have Part B, and Part B covers everything outside the hospital. Doctor visits, number one, most importantly, including when the doctor comes to see you in the hospital, and if a doctor does surgery in the hospital, that's covered by Part B. There's an annual wellness visit, preventative services like flu shots, all laboratory and blood tests, X-rays, MRIs, all the diagnostic tests, some health programs, physical therapy, occupational therapy, speech and language pathology, diabetes screening, education and supplies, mental health care, durable medical equipment for use at home, wheelchairs and walkers, ambulatory surgery center, which is outpatient surgery, and telehealth visits are now covered by Medicare Part B. Also, one that they don't cover here, infusions. If a person has cancer and needs chemotherapy, those infusions are covered by Medicare Part B. And some of the infusions for something like osteoporosis, again, also Medicare Part B. Next. So Medicare Part B, as opposed to Part A, does have a monthly premium. And it says adjusted for income, and I'll explain that. The monthly premium for Medicare Part B in 2024 was $175. But if a person or a couple make over an individual over $110,000 or so, a couple over $200,000, they are adjusted for income, and that's called IRMA, income-related monthly adjustment amount. And there is a scale based on your income. If you have a higher income, you will pay more for Medicare. You cannot be denied coverage, and it is nationwide. So anywhere in the United States, you can go to any provider who accepts Medicare. But there is a penalty for late enrollment unless you have a special enrollment period, and I'll get into that. Like one special enrollment period would be if you decided to work past 65. When you decide to start working, like I did at 67 and a half, I had a special enrollment period. Next. So Medicare does not cover everything. Original Medicare Parts A and B don't cover all the costs. Medicare covers 80% of Medicare approved charges. So the individual is responsible for co-pays, co-insurance, and of course, deductibles. Prescription drugs are not covered. Dental, vision, and hearing, which is what everybody asks me about. Everybody wants dental covered. It's not covered by Medicare. And everybody wants to know, why doesn't Medicare cover my glasses? But it doesn't. Long-term care or custodial care is not covered by Medicare. That would be covered by something called long-term care. Excess charges, some doctors do accept Medicare, but they charge extra. And there's no coverage, with some exceptions, outside the United States. Okay, so where can you get more coverage? How can you cover that other 20% and all those other charges that Medicare doesn't cover? Well, there are two basic ways, okay? And you can add like it says here, option 1, adding to original Medicare. You get a Medicare supplement policy, which is also called Medigap. And you would need a separate Medicare Part D drug plan, or you can get a Medicare Advantage plan, which is also now called Part C. And Medicare Advantage, most of the Medicare Advantage plans include a prescription drug plan. The ones that don't cover prescription drugs are basically for veterans who have outside coverage. Okay, next. Okay, so we're going to go into a little in-depth discussion about Medicare Advantage. It's another way to get your Medicare benefits, and it's an alternative to original Medicare. So you're still in the Medicare program. You still have to pay for Medicare Part B and have Medicare Part A and B, but you get a separate card, and that separate card is what you're going to be giving to your doctors. You're not going to give them your Medicare card because you don't want them to bill Medicare. This Medicare Advantage plan works with a private insurance company, but works with Medicare. And some of the plans offer extra benefits like dental, vision, hearing, and fitness. Next. So all the Medicare Advantage plans cover the benefits of Part A, so you can go to the hospital. All the benefits of Part B, all your doctors, they cover prescription drug plans, and you might have some of those extra benefits. Dental, hearing, eye exams, hearing aids, many of the programs, I should say, not most, many programs now include fitness. Okay, so there are different types of Medicare Advantage plans. We don't have all of these plans in New York, in our area. Most of them are HMOs, which are health maintenance organizations, and PPOs. And I'm going to explain the difference because that is a very big difference. If you sign up for a plan that's an HMO, you have to stay in the network of doctors, and you cannot go outside the network. And if you do, you have to pay out of pocket. A PPO, which is a preferred provider organization, you have the freedom to go outside the network. You just have a higher copay. This is unique to the Medicare Advantage plans. Okay, there are also special needs plans, which one of them I spoke of before, the dual special needs plans, which are for people with Medicare and Medicaid. There are chronic special needs plans for people with certain chronic conditions, and institutional special needs plans for people in nursing homes. And there are private fee-for-service plans and medical savings account plans. You know, I forgot to say, if anybody has any questions, please feel free, okay? So you must be enrolled in both Medicare Part A and B to get a Medicare Advantage plan, and they are, you know, localized. They're specific geographically. In other words, there could be a plan in Nassau County that we do not have in Suffolk County. And so they are very, very particular to your zip code. You can't be denied coverage based on financial or health status or any pre-existing conditions. And you will be required to use provider and pharmacy networks. Like I mentioned, that is the key to the Medicare Advantage plans, are the networks of doctors and hospitals. And as far as the drug plans, each individual insurance company has their preferred pharmacy, which is, you can go to any pharmacy, but you're going to get your best price at a preferred pharmacy. Coverage and costs vary by plan and may change each year. And believe me, they do change year to year. There is a limit on out-of-pocket costs, which is one very interesting fact for the Medicare Advantage. And they may charge a monthly plan premium, but believe it or not, there are some plans with zero premium, which is very attractive to people because they feel, well, I just retired, I'm perfectly healthy, and I'll take my chances. And that's what insurance is. It's weighing the risk versus the benefits. But you must continue to pay your Part B premium. Next. So any questions about Medicare Advantage? Because there is so much to know. I'm open to questions. Okay. Medicare Part D is the prescription drug coverage. Of course, there's two ways to get it. It could be part of your Medicare Advantage plan, but it could also be a standalone plan. You could possibly have just Medicare Part A and B and D. Okay, next. So Medicare Part D covers all the drugs that are commonly prescribed. There are brand name drugs, there are generic drugs, and there's lots and lots of drugs on each individual insurance company's formulary. The formulary is defined as the list of drugs that are covered by a particular company, a particular insurer. And some commercially available vaccines that are not covered, but most of them are covered by Part B. Okay, so the formulary, again, is the list of prescription drugs that are covered by a plan. And within the formulary, it is divided into tiers. Tier 1, which is preferred generic, all the way to Tier 5. And needless to say, Tier 1 are the least expensive medications. Okay. So now this is where we have a big change in the drug plan for 2025. So this year and previous to this year, there were 4 stages for the drug plans, and you can see them on the screen. Deductible initial coverage gap, also known as the donut hole, and the catastrophic stage. Typically, when people got to $5,000 out of pocket and went into the coverage gap, they could have an $8,000 out of pocket cost. Well, what's going to be happening starting in 2025? That number is now going to be $2,000, and the coverage gap is eliminated. So there will only be 3 stages. So now a person who takes many expensive medications, including the deductible for the drug plan, if they have a deductible, their out-of-pocket costs will only be $2,000. You can imagine that this change from $8,000 to $2,000. Now, this was all part of the Inflation Reduction Act, but it has upended the entire insurance industry, and the companies have made a lot of changes. They have eliminated plans. They have combined plans. One company had 3 independent drug plans. Now they're going to have 1. Another company had 3 plans. Now they're going to have 2. One company went so far as to eliminate the agent's ability to sell their plans anymore. Since the Medicare Advantage plans have the drug coverage incorporated into them, they are also going through changes, also eliminating plans, changing, combining. All the more reason that if you have a prescription drug plan or a Medicare Advantage plan, it would behoove you to speak to an agent and explain what the differences are. All the carriers have to send out letters with announcing the changes for the upcoming year, as far as the change in coverage, the change in the cost. Please, everybody, make sure you read the mail or the emails that come from your carriers. Any questions on the new prescription drug coverage stages? Okay, next.
I have a quick question about it. So
Yes.
you may have covered this and I maybe got distracted, but with the new much lower out-of-pocket costs, premiums are significantly higher, I assume, right?
That's correct. I'll give you an example. There was one plan that had a cost of $3.70, and that plan is going up to $38.70. Some of them have remained the same, though, I have to say. And there's one plan that I'm not allowed to talk about sales, but one company, their plan actually went down $3, and it's an expensive plan. But another thing to consider is the deductible. There's a deductible with many of the lower cost drug plans. See how it says on there, not all plans have a deductible. The lower cost drug plans have deductibles. And this year the deductible was $545. Next year it's going to be $590 for many of the plans. Higher priced premium plans have no deductible. So it's, again, you have to make a decision looking at all the facts. Do I want to pay more for a plan, have no deductible, and get very, very good coverage on my drugs, or pay less for the premium, have to pay for the deductible? You don't have to pay the deductible. If you only take tier 1 and 2 drugs, you won't have to pay the deductible. Most of the drug plans, the majority of the drug plans that have a deductible, it's only tiers 3, 4, and 5. So if you only take a preferred generic drug, let's say, you won't hit the deductible anyway. So those are all very, very particular details that pay for you to discuss either with an agent, or if you're really good with the computer, go on Medicare.gov. It's a great website. Does that answer your question? I know I went on a little bit. Okay,
Yeah,
next.
very helpful.
And everything is January 1st. So we're going to get into that now, but the beginning of the next plan coverage is January 1st. Okay. And the fun facts again, or I should say fast facts. You must be enrolled in Medicare Part A, B, or both. Like I said, you're not really required to use a pharmacy network, but you're going to get your best prices with the preferred pharmacy for your plan. And coverage and costs vary by the plan. They change every year. And this is very, very important. Your premium might have a penalty if you delayed the start of the prescription drug plan, unless you had a special enrollment period. And I'm going to go into that in a little bit. Okay. Helps Medicare. Okay, so now we went through the Medicare Advantage and the prescription drug plans, if anyone has any questions. Because now we can talk about Medicare supplement insurance, also known as the Medigap. I only call it supplement. So Medicare supplement works with original Medicare A and B. Original Medicare covers 80% of approved Medicare charges, and the supplement plan will pay after that. So when you go to the doctor, you're not going to give him one card, you're going to give him 2 cards. They bill Medicare first, and the supplement plan pays after that. Also you have to have Medicare A and B, and you can have Medicare Part D, and it is, certainly it behooves you to have Medicare Part D. You cannot have a supplement plan to pay for your Medicare Advantage costs. There are 10 plans that are standardized. All the companies that sell supplement plans have the same plans. The difference between the companies are the costs, customer service. And the plans are Plan A, B, C, G, F, etc. There are letters also. just in case you weren't confused enough. Plans with the same letter offer the same basic benefits. So United Healthcare might have the same as Humana, might have the same as Aetna, but it's all the costs. And like it says here, there's a couple of states have different configurations for their supplement policies, and they're offered by private insurance companies. Okay. And when you get a Medicare supplement plan, it will pay your hospital coinsurance, your deductibles, Part A skilled nursing facility coinsurance, which if you have a Medicare Advantage plan and you have to go into a skilled nursing facility, you only have up to 20 days. After that, it's out of pocket, but you have many more days, 100 days with the Medicare supplement plan. Costs of blood transfusions, hospice care, your Part A deductible, but Part B deductible is only covered by one plan, and that's Plan F, as in Frank. And that plan is only available to people who have turned 65 on or before January 1st, 1955. No, not turned 65. If they were born on or before January 1st, 1955, forgive me. There is some foreign travel in some of the Medicare supplement plans, and some of those extra charges that some providers charge may be covered. But supplement, one more thing on the back, on the last, supplement plans do not pay for prescription drugs. They don't cover dental, vision, or hearing. They do cover if you go to an ophthalmologist who is an MD, that would be covered, but not glasses, contacts, hearing aids, or long-term care or in-home care. Okay, next. Okay, so this is quite a confusing chart. I'm just going to suffice it to say these are the different Medicare supplement plans, and they all have differences in what they cover. And the top plan right now, in my opinion, is Plan G, even though you still have to pay the Part B deductible. It's much more financially feasible than Plan F. Plan F, once you have Plan F, you have the red carpet, but you pay for it. You get what you pay for. Okay, next. Here are the facts about the Medigap or supplement insurance. You must be enrolled in both Medicare Parts A and B and live in the state. You have to get your supplement plan from the state in which you live. If, let's say, you live in New York and you decide to move to Florida, you change your address and you might have a change of premium, because everything is statewide in the insurance business. There is no medical underwriting for up to 6 months after enrolling in Part B. So in other words, if you turn 65 and you retire and you sign up for Medicare A and B, if you sign up for your supplement plan within 6 months, you don't have to do underwriting. Underwriting is an investigation into your entire health background. There's nationwide coverage and no provider networks. That's the biggest difference between the supplement plans and the Medicare Advantage plans. You can go to any doctor, any hospital, anywhere in the United States who take Medicare. And it's guaranteed renewable as long as you pay your premium. And like from company to company, you're going to have a variation in the cost of the premiums. Plans with more coverage, obviously, will have higher premiums, but you must pay your Part B to get your Medicare supplement or your Medicare Advantage plan. And I had a client that called me just a few weeks ago. He got a bill for his Medicare It got tossed onto his desk. He stopped paying his Medicare Part B, and he lost his Medicare, and he lost his Medicare Advantage plan for a few months. He was able to get reinstated, but don't stop paying your bills. And the best way to pay is either if you collect Social Security, to have the Medicare Part B come out of your Social Security, or EFT, electronic funds transfer. Okay, next. Any questions? Keep going. We're doing great. And speaking of cost, how much does Medicare cost? Well, there's a fixed amount that you pay for Part B. We explained Part A doesn't cost you anything because you've been paying for it all your life in your paycheck. Part B this year was $175. There are deductibles this year. Part B deductible was $240. And once you cover that deductible, you're done for the year. But it's January 1st to December 31st. If for some reason, whatever reason, you turn 65 in December, if you start Medicare in December and you go to the doctor, you're going to have to meet the deductible in December for 2024 and then January 1st for 2025 again. So I make sure to tell all my clients who turn 65 or start Medicare in the last quarter of the year about that deductible. I don't want any surprises. Copay is a fixed amount you pay at the time you receive. You go to the doctor and you have a copay. So if you have Plan N, let's say, from a supplement plan, you're going to pay up to a $20 copay. If you have a Medicare Advantage plan, it's a little harder to make a predicted amount of costs for the year because specialists are so much more than the primary care doctors. Generally, primary care doctors are $0 to $5, and specialists could be $40 to $50. And if you're on a PPO and you want to go outside the network, it could be $60 for your specialist. Co-insurance is a percentage. So if a person, let's say, has to have an MRI and the Medicare Advantage plan says you have to pay 50%, okay? So if the MRI is $600, you're paying $300, okay? So that's what co-insurance, that's the difference between copay and co-insurance. Copay is a fixed amount, co-insurance is a percentage. Next, questions? Okay, so like I was saying with the Medicare Advantage, premiums are lower. You might even have a zero premium, zero monthly amount, okay? You will have deductibles, copays, and co-insurance. And Part D, you will have a monthly premium. There are no free prescription drug plans. And there could be a deductible. Like I said before, lower cost plans have a higher deductible. Some have an in-between, but the higher price premium plans have no deductible. And depending upon the medication, you could have a copay. And you could have a zero copay as well. The Medicare supplement plans have, one more, go back. Medicare supplement plans have the monthly premium. You may have a deductible and you may or may not have copays. Okay, and the Medicare Advantage plans have an annual out-of-pocket maximum for covered services. And in-network and out-of-network would be different. So here's the question. How do you choose what to get? Okay. Now, what I tell my clients, don't even look at this for a minute. I tell my clients, I want you to be comfortable in two ways. Generally, when people call me, they're strangers. I don't know them. I don't know you, Mark. But I tell people, I want you to be comfortable with the coverage that you have, but I also want you to be comfortable in your pocketbook. Okay? So these are all the different combinations. If I know people that just have Medicare Part A and B, they're fine with that. They're willing to take the risk. That's the definition of insurance, is assigning the risk to the insurance company. You can have Parts A and B and just have a drug plan. You can have Parts A and B and just have a Medicare supplement plan. Of course, you could have the drug plan and the supplement plan. And with the Medicare Advantage plan, most of the Medicare Advantage plans, of course, you have to have Part A and B. Most of the plans have the Part C, C and D, have the prescription drug plan incorporated into the plan. But some of them, like I said, for veterans who have veterans drug coverage outside, there are Patriot plans, they call them, with only the Medicare Part C and no drug plan. Next.
Quick question on this slide, Rhonda. So on the Medicare Advantage column, that Part C, that coverage is really equivalent, if I understand correctly, to Parts A, B, and at least your Medigap, right? So in other words, is that correct?
Yes. Part C, the Medicare Advantage plans cover hospitalization and doctors. Everything you're going to have with original Medicare, okay, and the supplement plan. But the costs and the co-insurance might be different.
Thank you.
And of course, you have that network of doctors. Big difference. The Medicare Advantage plans, you have to stay in the network of doctors. Medicare supplement, any doctor, any hospital, anywhere in the United States who take Medicare. So how do you make the choices? Here's something else I tell my clients. You're never married to a plan. If you make the decision to start with, let's say, Parts A and B and a Medicare Advantage plan, and then God forbid something happens, you have to go to a lot more doctors, you want freedom to go outside the network. Once the annual enrollment period comes up, which we're in right now at this time of the year, you can switch over to a Medicare supplement plan and a drug plan. And vice versa. If you feel the supplement plan, if you start with the supplement plan, perhaps it's too expensive, you're running out of money, you didn't use Snyder Wealth Management to retire, then maybe you'll want to go back to a Medicare Advantage plan and have a lower premium. That's why we sit down, we talk about your needs, we talk about your budget, and we work out the best thing. My most important thing working with clients with a Medicare Advantage plan, because needless to say, we have all the advertising on TV and everybody wants dental, everybody wants eyeglass coverage, and everybody wants all the benefits. But I have to make sure that your doctors are in the plan. That's the most important thing to me, not a pair of glasses. Next. And here you go. Here's all the considerations. This is what I'm talking about. Coverage, cost, and convenience, okay? We have to do the best thing. Everybody has different needs. And even within one family, a husband and wife might have totally different needs. Everything is individual. Many people feel that they can do this themselves. They can go on Medicare.gov. You can put your doctors in, you can put your drugs in, and that's great if you're good with the computer. And something I tell all my clients, and no matter how old they are, I want you to stay on that computer, because honing your computer skills will continue you into the next decade. But if you stop using the computer and you rely on your phone, let's say, although the phone is a great computer, you're going to lose those skills, and those skills are so important. You don't want to have to call your grandchildren. I need to print something out. Can you print it? Come on. We can do it. And that's what I tell my clients. But that's how you make the decision. What can you afford? How much coverage do you need? Are your doctors and your drugs in the plan? And that's the most important thing. Next.
Rhonda,
Questions? Yes.
Rhonda, this is Lloyd. I do appreciate all the information you're sharing with us, and
Good.
I'm pretty much aware of everything. Unfortunately, I do have to log off. I have another thing I have to take care of
It's
now.
okay. Thank you so much for joining us tonight.
It was my pleasure. And again, I always like to listen in on these kinds of things because I always learn, no matter how much I think I know, I always learn something new. So
Well, I hope
thank
you
you
learned
again.
something tonight.
And thank Mark and the team for organizing this.
You just did.
Take care, Lloyd.
Thank you, Lloyd. Have a good
Bye-bye.
night.
Okay, when can we enroll? Okay, so you're turning 65. You can enroll 3 months before the month of your birthday, the month of your birthday, and 3 months after. My watch was doing something, sorry. So let's say your birthday, like mine, was August 2nd. Okay. So if your birthday is August 2nd, you can start applying for Medicare in May, June, July, and then 3 months after, September, October, and November. However, if your birthday falls on the first day of the month, you're eligible to start on Medicare the month before your birthday. So if my birthday was August 1st, I'm eligible to start Medicare on July 1st. Okay? If you are receiving Social Security before 65, people do sign up for Social Security at 62, they automatically enroll you in Medicare. Okay? Let's see, is there anything I left out? Also, people on disability are over 2 years are enrolled already in Medicare before they're 65. And give yourself time. If you know that you're turning 65, don't wait if you want to go on Medicare because they're very busy. There are 10,000 people a day turning 65 in this country. Okay, next. Okay, so there's a general enrollment period for people who miss their initial enrollment. So when you're turning 65, that's called the IEP, the initial enrollment period. And if you miss that, you can enroll in parts A and B from January, February, and March. And then April, May, and June, you can get a Medicare Advantage plan and a Part D. And you might have a late enrollment penalty. Next. Okay. The open enrollment period for a Medicare supplement plan is 6 months after you turn 65. So if you're turning 65 and you're enrolling in parts A and B, you have 6 months to sign up for a Medicare supplement plan for the first time without any enrollment penalties or underwriting. That's what it is. No underwriting. Okay. That's in New York, there are different rules in different states, but this applies to New York. Next. Okay. So special enrollment periods. There are many special enrollment periods. When you work after you're 65, and then let's say when you're 70, you decide you want to go on Medicare. Okay. Hopefully you're going to have Part A. There's no reason why a person doesn't sign up just for Medicare Part A. This way you have your Medicare part, your Medicare card with your Part A. But you decide at 70 you're going to retire, then you have 8 months to get your Medicare Part B. You have a special enrollment period. However, You only have 63 days, 2 months, in which to get your Medicare prescription drug plan, or if you want to get your Medicare Advantage plan. And that's very important, because if you wait more than 2 months, you will have a penalty, and the penalty lasts for life. Next. Okay, so here are the penalties. Nope, go back. Here are the penalties for the late enrollment. So the late enrollment for Medicare Part A, none, of course, if you're qualified for a premium free, but for people that have not worked and have not paid, there is a 10% penalty. Medicare Part B, again, if it's in your special enrollment period, if you have just turned 65, forget that. If you have just retired and you're over 65, there is none, but it's 10% of the monthly Part B premium for each 12-month period or year that you have delayed enrollment. But here's the most important one. The Medicare Part D, if you wait more than 2 months, and people wait 10 years, believe it or not, here is the penalty. It's a formula. It's 1% of the average Part D premium of a plan for each month that you have not had a prescription drug plan. So if, let's say, right now, the average cost of a drug plan is $50, which it might be actually higher than that for 2025. But if it's $50, 1% is 50 cents. But if you wait 1 year, 12 months, you're going to have to pay $6 more. Or if my math is correct, which I think it is, $6 more every month added on to your premium of your drug plan for the rest of the time that you have a drug plan. So it's imperative that you do get your Part D or your Medicare Advantage plan within the 63 days. Next. And when can you change your coverage? Something I tell all my clients, of course, you're never married to a plan. October 15th, December 7th is our annual enrollment period, in which I am now in the middle of and going crazy because there's lots of changes and lots of people that need to make changes. There's also a Medicare open, and well, okay, that's on the next screen. But at this time of the year, you can change from one Medicare Advantage plan to another. You could change from a Medicare Advantage to a supplement plan, and you can change your drug plan. And if a company is eliminating a plan, you actually have until the end of the year, because the plan goes until December 31st. So even though the annual enrollment period ends on December 7th, if your plan is being eliminated, you have till the end of the year. Next. Medicare Advantage plan holders only have another open enrollment period from January 1st to March 31st. And at that time, a person, let's say somebody signs up for one Medicare Advantage plan now during the annual enrollment period. And in January 15th, they find out the doctor dropped out of that plan. They have that 3-month period to sign up, one-time change to a new Medicare Advantage plan, or they can go back to original Medicare and get a supplement plan and a drug plan. Next. And of course, special enrollment periods. These are times in our lives where things change. You move from New York to North Carolina, you're going to have to get a new plan. or if you're retiring and you're over 65, or your coverage, you had COBRA after you turned 65. So those are, nope, you can go to the next one. Those are all reasons for a special enrollment period. And again, you have 2 months to change your plan once you move. Okay. Everybody wants to know how they can save money. Well, of course, use your benefits wisely. Get your flu shots, most importantly. When you become a Medicare recipient, you get a preventative checkup from your primary care doctor. Make sure you have a primary care doctor. I can't tell you how many people actually say to me, oh, I don't have a primary care doctor. You know what? Your primary care doctor, no matter what plan you have, is like your general contractor. If God forbid you come down with a terrible symptoms or a chronic disease, your primary care doctor is the person who's going to steer you in the right direction to the right specialists. And believe me, it happens to many, many people, including me. Use your plan's provider network. Ask about generic medications. Sometimes you might be on a brand name drug and it's very costly, and you can be on the generic medication. Make sure, like I said before, you stay in the preferred pharmacy network or mail order. All the insurance companies now have mail order pharmacies. And understand your status in the hospital. Well, I think very importantly, make sure you take an advocate with you to the hospital as well. Because when you're in a stressful situation, we tend to not hear everything that we really need to hear. So take someone with you. Next. There are financial assistance programs within your state. There's extra help for Medicare Part D. There's low income assistance. There's lots of programs. I'm just going to get some called EPIC. EPIC is Elderly Pharmaceutical Insurance Coverage Program. This works with your drug plan. This is not a drug plan, but it works with your drug plan. And if you qualify, you can get help with your copays. Medicaid, again, is a state program that you might qualify for. There are Medicare savings programs and the PACE program. And of course, you can always call 1-800-Medicare, and they're pretty good on the phone. There are local numbers for your local Medicare office, and there's, of course, 1-800-Medicare nationwide. Next. Where can you go for help? You can come to me, and I'll be happy to help, or you can go on Medicare.gov, which is a wonderful website. This is Medicare Made Clear, which was developed by United Healthcare. And there's lots and lots of information online. Next. And there you go. There's all the information I was saying. If you'd like, we can put my information in the chat. If you want me to put my my phone number in the chat, I'll be happy to. Any questions? I think that might be the last. Is that the last slide?
I think that's it.
Thank you.
Yeah, and yes, please share your phone number.
I will
That's the best
do
way for
that
people to reach
right
you.
now. I'm going to do that right now.
I had one or two more questions, but I wanted to see if anybody else had any as well. Anybody else want to ask a question? Feel free to unmute yourselves at any point. So one of the questions I was wondering about is for people who have not worked into enough credits to earn the Medicare benefit. Do I understand correctly? They can still enroll, they just have to pay the premiums and it's a
Yes,
little bit
as long
higher.
as they qualify as far as being a United States citizen or a legal resident, yes, you can pay.
Okay, interesting.
I had one in a recent discussion with an estate planning attorney. They mentioned Medicaid payment toward caregivers can be tax exempt. Do you know anything about that for Medicare qualified caregivers?
Um, Say it again. Medicaid,
Right. If you have a family member who provides care for you,
right,
and Medicaid reimburses them for their
right,
time, right?
right.
So that income can be tax exempt. But I don't know if the same applies to Medicare. And I was doing a little bit of background research on that.
You mean if somebody cares for you, if Medicare will pay? No,
Correct.
Medicare does not pay for home health services.
All right. That was it.
Okay.
If somebody's coming in or calling you, or what should people be prepared with to have a productive discussion with you about choosing their plan, choosing their different options, and evaluating everything?
Good question. First and foremost, their Medicare card. They need their Medicare number. If they want to look at a Medicare Advantage plan, I need to know the doctors, needless to say, the medications, and of course, where they live and where they're going to live when they retire. If somebody comes to me and goes, "Well, here we are. It's November, and I'm signing up for Medicare, but I'm moving to North Carolina in January." So that, where they're going to be living at that time when they're going to be, starting their Medicare, because I have to be licensed in the state in which I sign them up. Does that answer the question?
Yeah,
But
perfect.
most important, to tell you the truth, the Medicare card, that's number one.
Good. So not a big hurdle. And it's not like they have to,
No,
it's not like
no.
meeting with us where they have to bring a box full of documents,
Oh,
right?
yeah. No. But
Good.
they have to, people have to, like I said before, they have to know where their budget is and what their condition is. But the whole thing is, this is why we have insurance, because we never know what's going to happen tomorrow. That's it.
And maybe it's a little early to speculate, but are you aware of or thinking about any of the potential changes that may be signaled by the incoming Trump administration and the new Congress, of course?
I'm scared. I don't want to bring politics into this naturally, but there's no way of knowing. Of course, nothing that happens in the new administration will affect the plans, because once the plans are set for 2025, those are set, okay? And unless a company goes out of business, let's say, which God forbid, I mean, these are tremendous companies and cover millions and millions of Americans. But things do happen. And if God forbid a company went out, but that has nothing to do with the administration. Companies merge. There is one of the big insurance companies is perhaps going through a merger. So that's a possibility, but there's, no way of knowing. All I can say is get your flu shots, keep yourself healthy, put on in the house. It's okay if it costs you a little extra for your oil. Don't sit and freeze in your house. stay healthy, eat properly, exercise, do all the right things, and try to minimize the stress in your life.
Yes, focus. That's how we think about it too. Focus on what we can control.
That's it. We can only control ourselves, hopefully, and enjoy your children.
Drink your Ovaltine.
Drink your Ovaltine. Oh God, I haven't seen that in years. Any other questions?
Yes, I was wondering about the Epic plan. I was
Yes.
looking into it. But based on what I'm seeing, if you're widowed by yourself, you have nothing to claim. That Epic plan is not helping you a lot if you have a pension plan that's paying you.
Well, that's it. It is income based, and there's if you want, I can unless you have the form, but you can always apply for it. If what's the worst thing they can do? Turn you down, you know?
It's true. That's true.
Right. And who are we speaking to?
Oh, this is Charmaine Handy, one of Mark's
Hi,
folks. Been with
Charmaine.
him for
Hi.
25, 30 years.
Hi, Charmaine.
I knew it was you.
You actually sound like another client of mine.
Yes.
We were supposed to meet yesterday.
I know. So it's going to be next week.
It's
Promise.
next week. I know.
So, yes, this was very interesting because
Thank you.
I have a tier 3 medication that I'm on. And boy,
Right.
is it knocking me out, that tier 3. You know, it depends on what medication you're on.
It depends on the plan for next year. If you want to call me, I believe I put my number in the chat. Did it go in?
Hey, I made a copy of it, so I'm making sure it's
okay.
there.
Because there are some plans,
Yes.
even though they are higher priced,
Yes.
they have a lower, the higher priced premium has a lower copay for the drug. And there's one drug in particular that many people take called Eliquis.
Yes.
And that drug is higher priced on one plan and a third the price of another plan.
Wow.
But you have to recognize the fact you're going to be paying more for the premium.
Yes.
So I have many clients that are like saying to me, Rhonda, what should I do? Should I pay the lower premium and the deductible and the higher price for the drug, or the higher price for the premium, no deductible, and a lower price for the drug? It's so difficult to answer the question. And a very good friend of mine and I went through this today with him. And he figured it out. It's $1 difference a day. $1. $1.
Wow.
And when you come down to it, he said, the heck with it, I'm getting the higher price plan. And I'm not condoning that. I'm just saying you have to do what is best for you, because I'll tell you why. What if you get the higher priced premium and you stop taking the drug? Okay,
Yes.
you could stop taking the drug, but if you know you're going to take the drug, you might be better off with the higher price plan. So it's definitely individual, and like I tell everyone, you're never married to a plan. You can always change plans from year to year. And one benefit of the supplement plans is that you can change from, let's say you have plan F as in Frank, and you want to go with a little lower premium, you can change to plan G anytime during the year. I fill out the form, send it into the company, and it becomes effective the first day of the following month. That's with supplement plans only.
Okay. Thank you.
You're welcome.
Good. Any other questions? This was really helpful, Rhonda. This was great.
Thank you.
Really appreciate it.
Thank you. Thank you. Everybody needs to know about Medicare.
Yeah. So if there's nothing else, we'll wrap up. Again, thank you. Thanks everyone for attending and asking good questions.
You're
Hope this
very
was
welcome.
helpful.
And if you recorded, I know you have other clients that might want to, I wanted that client we were talking about before, she had requested if it was being recorded and I wasn't sure.
She did, yeah.
Yeah.
She reached out earlier and we'd let her know that we'll send that presentation
Terrific.
as soon as we
It was
get
my
the recording.
pleasure. Thank you all
Thanks, man.
and stay warm.
Thank you.
And pray for rain here in New York. Oh my God. We need rain so badly.
True.
Yeah.
Thank you, Rhonda.
Thank you. You can always get in touch with me if you have more questions.
Absolutely.
Have a nice evening, everyone.
Take
Bye-bye.
care.
Bye.